Professor Sir Kent Wood's exemplary leadership in academic clinical pharmacology and medical regulation has helped bring medical innovation and safe treatments to millions in the United Kingdom and throughout the world. His clinical research on cardiovascular disease, training new generations in healthcare and public health, and leadership in UK healthcare charities and international health collaborations have all had significant impact on public health. A Cambridge graduate in medical sciences, Sir Kent trained in internal medicine and clinical pharmacology at Birmingham University. A conversation about his doctoral research on breast cancer with eminent British physician Sir Richard Doll helped Kent realize the need for more grounding in epidemiology. With the guidance of Professor Brian McMahon, then head of our Department of Epidemiology, Sir Kent chose the Harvard T.H. Chan School of Public Health to continue his training. Traveling to Boston with his wife Rose and 3 young sons, Sir Kent graduated with his MS in epidemiology in 1983. He credited his time at Harvard with shaping his approach to clinical research. In 1984, Sir Kent took a tenured position in therapeutics at the University of Leicester, overseeing one of the busiest cardiovascular units in the UK and presiding over research on pioneering new treatments for cardiovascular medicine. These innovations helped more patients survive, and the hospital saw a 40% drop in fatalities from myocardial infarction in just 7 years. Sir Kent published prolifically, with more than 160 papers in prestigious medical journals over his career. He has been an Emeritus Professor at Leicester since 2013. In the 1990s, Sir Kent also began his preeminent career in government health policy. He served as Regional Director of Research and Development for the UK's National Health Service, before becoming Director of the NHS's Health Technology Assessment Programme in 1999. He left clinical practice in 2004 to become the first Chief Executive of the UK's newly created Medicines and Healthcare Products Regulatory Agency, a position he held until 2013. Under his leadership, MHRA quickly developed a reputation for efficient and pragmatic regulation driven by strong science, and for actively communicating the risks and benefits of medical interventions to the public. The agency received a National Business Award for Better Regulation in 2008. Sir Kent also focused on creating productive international partnerships among regulatory agencies. He participated extensively in joint activities like the Global Summits of Medicine's regulators, and worked to strengthen ties with regulatory experts in China and other nations outside of Europe. These interagency relationships would play an important role in handling global crises like the swine flu pandemic. Widely esteemed for his work, Sir Kent's European colleagues twice elected him chair of the Management Board of European Medicines Agency. He is a Fellow of the Academy of Medical Sciences and Royal College of Physicians, and an Honorary Fellow of the British Pharmacological Society. Sir Kent was knighted for his services to healthcare in 2011 in a ceremony at Buckingham Palace. In retirement, Sir Kent joined the board of the British Heart Foundation, a major funder of cardiovascular research. He and his wife Rose also travel internationally and throughout England, indulging their passion for history, culture, and architecture. As president of the Leicester Literary and Philosophical Society, he has demonstrated the role of civil engineering in drastically reducing infant mortality in Leicester at the turn of the 20th century. His role in the progress of public health is also strikingly clear. For improving and protecting public health through international leadership in health regulation and academic medical innovation, the Harvard T.H. Chan School of Public Health honors Professor Sir Kent Woods with a 2020 Alumni Award of Merit.
Hello, my name is Kent Woods. I'm delighted and honoured to receive the Award of Merit for 2020. I have warm memories of my time at the school, and it gave me a set of skills I've used throughout my career. As we tackle this present pandemic, the profile of public health has never been higher, and I know the many valuable contributions which the school is making in so many different areas. I have the pleasure of meeting Dean Williams from time to time when she visits London, and I know how the school is continuing to grow, continuing to flourish, and to do good work across the whole field of public health. Those contributions have never been more necessary. I send my thanks to my fellow alumni and my very best wishes.